Breaking news, more than 200 Americans flown out of the coronavirus epicenter in China just arrived at March Air Reserve Base in Moreno Valley. All passengers on board have been through several health screenings, but they will be checked out again here before they are able to return home.
So getting that call initially to respond to the March Air Force Reserve Base was very eye-opening. We didn't know what to expect. We were hearing about the pandemic. And so as our team started to respond, we recognized that this was going to be a pretty big situation.
Looking back, there's amazing things that we did leading up to this pandemic that really situated us to be, I think, a leader throughout the state and in some ways even nationally. Tests were really in short supply, and there were private partners that had access to it. And so because we set up drive-through testing sites really early, they gave us thousands of tests that they were trying to distribute. So that allowed us to really sort of lead the region in testing.
It was tiring, it was exhausting, but we knew we had to do what was right for the community as a safety net institute, as a hospital with the ability to actually reach the masses and to actually help the community was really important, but it was exhausting.
There was all these kinds of techniques of how to improve the care we were providing for COVID patients. And so the Innovations webinar group arose out of that, and making sure that we could disseminate as best possible these kinds of things for our teams as well as for any other partners in the area. And then it's expanded a lot beyond that.
When it first hit, Jen told Janice and I that we needed to get enough space for about 1,300 patients. So we stayed here one night and literally went through every nook and cranny in this organization of where we could potentially be able to provide care to patients.
Going through the surges was tough. We utilized a lot of areas in the emergency department that we normally wouldn't have. We opened up, hallways, and all you saw was gurneys and, just staff everywhere and IV poles.
So when we opened up the Medical Surgical Center here on campus, I felt really rushed. It was the middle of the pandemic, and our timeline was pushed up because of the COVID pandemic. But that gave us an opportunity, to get things in line, operational efficiencies that we could straighten out before we had full patient panels here. I think, especially for our providers and our patients, a lot of satisfaction with not necessarily having to go into the medical center. I think there was a lot of apprehension from our patients to come into a hospital to get care, where this is not viewed the same. It's an outpatient building. Also, a lot more space here, so you don't feel as crowded and cramped together. So that was nice when you're trying to socially or physically distance as well.
The level of oxygen that was required to take care of our patients was insane. I had a tech assigned to oxygen tanks one day, and that was his only job, was refill all the oxygen tanks on all these people who have COVID, because we just couldn't keep up. The first winter surge, people were just dying, and the ICUs were so overwhelmed, and the ER was so overwhelmed, and everybody was just sick, and there was no rhyme or reason as to who was going to get sick and who wasn't going to get sick and who had COVID and who had something completely different. So it was really hard to navigate.
The term burnout, what's causing this, and how would you define it? Is it more mental, is it more physical, or a combination of both?
Well, there is burnout. There is burnout in healthcare, but I also like to refer to it as moral injury. I think it constitutes many different aspects. It's physical, emotional, mental, and it takes a toll.
There's this notion, which is, I think it's easily disabused folks of, but that healthcare workers are superhuman, are invincible, and nothing can touch them. But in reality, everybody is human. And what we saw from the behavioral health perspective is that a lot of folks, dealing with the stress and the strain and the sickness and the death over and over and over again, really affected a lot of healthcare providers.
It'd be like in the middle of the night and I would like wake up like panicked and like couldn't go back to sleep, and he, would tell me like, you can quit your job, and I'm like, but it's not just a job. We don't become nurses for the paycheck, for, the title. It's really, I feel like, a calling and a passion.
I give it 110% every time I'm here, because I would hope that if I'm ever in a position where I'm being taken care of, or my family members or friends or whatever, that person is going to give it their all also.
You just watch it, every sector and every facet of ways we could help give resources and support the community. RUHS was doing that, trying to help lead the way to help ensure every patient that needed services and care got what they needed. I just think that the strength of this community and how everybody came together is the most profound thing I can remember.